and expend the amount of $8 million in the form of a grant awarded by the United States Department of the Treasury to be administered by the City of Boston's Chief Financial Officer, Collector Treasurer. The grant will fund the expansion of Fare Free Transit Program. This grant payment is made from the Coronavirus State and Local Fiscal Recovery Fund, CLFRF, in the Treasury of the United States, established by Section 9901 of the American Rescue Plan Act of 2021. This docket was sponsored by Mayor Michelle Wu and referred to the committee on November 17, 2021. Before I explain a bit more about the grant, allow me to read into the record that we are hosting this hearing virtually according to Chapter 20 of the Acts of 2021, which modifies certain requirements of the open meeting law and relieving public bodies of certain requirements. This enables the City Council to carry out its responsibilities while adhering to public health accommodations and ensuring public access to its deliberations through adequate alternative means. The City Council will be conducting this hearing virtually via Zoom, and it is also being recorded. The public may watch this hearing via live stream at www.boston.gov/city-council-TV and live on Xfinity 8, RCN 82, and Verizon 964. This hearing is being recorded. It's also being rebroadcast at a later date. Written comments may also be sent to the committee email at ccc.covid19@boston.gov or Christine with a C .O'Donnell, ODONNELL @boston.gov, and will also be made part of the record and available to all councilors. If you wish to provide public comments, please email Christine O'Donnell at christine.o'donnell@boston.gov for the link if you have already not done so. Under the terms of the order, the grant shall be used to serve communities and families most affected by the public health and economic impact of COVID-19 pandemic, including disproportionately impacted low-income families and communities of color impacted by the exacerbated systemic health and economic inequalities, in the amount not to exceed $8 million, including but not limited to the expansion of the Fare Free Transit Program. I know that we've been joined here by several colleagues, and Christine, I know that Councilor Sabi George was on first. I'll get the exact order from Christine via text, but I know that we had a little bit of a change in the order. So if Vineet, it's my understanding Vineet Gupta, who's the Director of Planning for the BTD, you will be taking the lead from the administration. You're also joined here by Casey Brock from A&F. She'll also be assisting questions. Are we anticipating anyone in addition to both you, Vineet, and Casey from the administration? Very good. So at that point, then, just assume waive openings just to get right at it. And you have the floor to make a presentation, Vineet, from the administration. And then we'll go from there. And in order of my colleagues' arrival, we'll get into questions.
Thank you, councillors, for giving us an opportunity to describe to you the program that this proposal includes. Essentially, we want to launch a free fares pilot for routes 23, 28, and 29. And I'll go through very quickly where these routes are and then talk about some of the benefits. These routes form the backbone for bus riders in the Dorchester, Mattapan, and Roxbury neighborhoods and are essential to their livelihood. So for example, Route 28, which is the current pilot, the 4-month pilot, goes from Mattapan Square through Grove Hall to Nubian Square and connects with Ruggles. Route 23 starts in Dorchester from Peabody Square at Ashmont Station and then uses Washington Street, connects up with Warren Street through Nubian Square and also to Ruggles. And finally, Route 29 starts at Mattapan Square, but goes via Seaver Street and then takes advantage of the recently completed center running bus lane on Columbus Avenue to connect up with Jackson Square. The reason why we want to do a 2-year pilot is, one, for it to have lasting economic benefits, but also to give us a time frame to do a very detailed evaluation of the program. A majority of the riders on these routes are low income, and free fares will lessen riders' financial burden at a time of high economic vulnerability as we recover from the pandemic. Because we have the proposed pilot for 2 years, this allows families to kind of manage their household budgets and plan for the full 2 years rather than being restricted to kind of thinking it through month by month. Secondly, while there's high ridership on these routes, these neighborhoods are currently underserved by quality public transportation. Free fares will allow more affordable and better connections for opportunities, whether you're connecting to jobs, to community facilities, or to education. Third, eliminating free fares means all-door boardings at bus stops, which means less time at bus stops and more time savings overall for your trip. This improves reliability as well for bus lines. And of course, like I mentioned, the fact that we have center running bus lanes on Columbus Avenue, which is part of this overall network, helps in connectivity and improving bus ridership as well as reliability. Those were kind of the main benefits that we wanted to stress. As next steps, we will, once this order is passed, we will meet with the MBTA and figure out the operational and financial logistics. We'll be building on the Route 28 experience that we've just had. So that's one step. The second step is really to develop a detailed evaluation framework. We need to do this to make sure that we have enough data before the pilot starts and during the pilot, particularly as the pilot progresses over 2 years. And finally, we do want to start a marketing campaign, and we will get that going because we want to get the word out in the neighborhoods. So riders are aware of the program, can take advantage of it, and plan their lives accordingly. So those are three key next steps that the administration will be following. And that's my quick overview, councillors. Again, thank you for the opportunity, and Casey and I are here to answer questions that you may have.
Good. Thank you, Vineet. I'm in receipt of a letter from our colleague, City Councilor Lydia Edwards. It says, "Dear Committee on Boston's COVID-19 Recovery, I regret to inform you that I will be unable to attend the hearing on docket 1205 this morning. I strongly support this docket, which is to expand the fare-free bus pilot program for the 23, the 28, and the 29 lines for 2 years. These bus lines are vital to connecting communities they serve to jobs, healthcare, and important resources. The 2-year pilot program will help us learn and better provide equitable and multimodal transit options for Boston residents in the future. My staff will be attending the hearing, and I will thoroughly review the video, hearing minutes, and public testimony. Sincerely, City Council Lydia Edwards." And then I just have a couple of quick questions, and then we're going to turn it over in order of arrival. It's going to be City Councilor Anissa Rasabi George, followed by City Councilor Kenzie Bach, followed by City Councilor Julia Mejia. I also see that City Councilor Matt O'Malley has just joined as well. And I'll just be brief. I guess, what type of coordination was done with the MBTA on this initiative? When can residents expect the program to be rolled out? And maybe can you just discuss some of the preliminary anticipated financial cost of running this pilot?
Sure, I can do the first set of questions, and then Casey and I can get to the financial side. But we, as you know, Councillor, were working hand in hand with the MBTA for the Route 28 pilot. And so in advance of this pilot being announced, there were some brief conversations between the administration and the MBTA's general manager's office to start things. And we are hoping, based on our discussions with the MBTA, that the pilot would start sometime early 2022. We don't have an exact date at this point, but we should be able to lock in a date. Remember that the T has to tell its bus operators in advance that it's going to be free fares, and they have to adjust accordingly. So there's some operational logistics that need to be got right before the pilot is launched. Casey, did you want to talk a little bit on the financial side?
Sure. And then on the financial side, I think what's important to note is for this appropriation, we did have to make some, we wanted to estimate out over 2 years what we thought the program would cost. And there are obviously some unknowns over 2 years. We're still in the midst of a pandemic. We are seeing ridership rebound, but it remains to be seen kind of what that trajectory looks like in the future. So we had to make some assumptions based on the Route 28 pilot. and what we've seen as costs so far through the Route 28 pilot, and then how we kind of expect ridership to rebound over the next couple of years. And so with those kind of assumptions in place, we estimated out what the potential costs were for 2 years across those 3 routes. And we also wanted to budget for potential of ridership growth. So, over 2 years, there is a potential that given the fare free pilot, that ridership could grow beyond pre-pandemic levels. And so we wanted to create some contingencies in this appropriation to allow for that potential growth over 2 years as we see the impact of this program. The other thing that Vineet mentioned that I think is really important is we wanted to make sure that we were budgeting properly for marketing and evaluation. For the reasons that Vineet stated earlier, we think that's a really important part of this program to telling the story of why fare-free bus ridership is important and impactful to Boston residents. So, that is how we kind of built the budget for this program over the next 2 years. But we recognize that, we had to use some estimates. So our kind of commitment is that as kind of with the Route 28 pilot, any unused funds that are have been appropriated at the end of 2 years would either be used to extend this pilot or in support of kind of fare-free transit in general.
Good. Thank you, Casey. We've also been joined by Councillor Ed Flynn. Chair now recognizes Councillor Anissa Asabi-George for questions.
Thank you, Mr. Chair, and thank you, Vineet and Casey, for joining us this morning. Will there also be, as part of this planning over the next 2 years, any exploration on where there could be additional funds to extend this, assuming that it's successful, which I imagine it will be?
Yes, Councillor will be continuously evaluating the program, seeing what opportunities there are to extend it. A lot will depend on the data that we collect and the ridership trends that we see. We want to make sure that it's that if we do extend, it's concrete, well thought through, and therefore more easily funded with any excess funds or other sources of funds.
And then on the COVID, because we're using the COVID relief dollars, are there any limitations on how this could be utilized over a period of time? Because I know that this will be, this is more appropriately placed in our operating budget, something that we should be investing in over the long term, but the ARPA dollars are temporary opportunities for investment.
That's right. The American Rescue Plan dollars that are funding this appropriation are eligible for spend through the end of December 2024. So, coming up just about a little over 3 years from now. Those are terms set by the U.S. Treasury. And so, like Vineet said, we look forward to kind of conversations about longer term funding options.
Great. That's it for me, Mr. Chair. Thank you, Casey. Thank you, Vineet.
Thank you, Councillor Asabi-George. Chair recognizes City Councillor Kenzie Bach.
Thank you so much, Mr. Chairman. And I should say at the start, as I said at council, that I'm excited about this and definitely in favor of passing the appropriation. Vineet, I just wanted to ask, how can you refresh me on how do we count ridership given the fact that people aren't swiping Charlie cards or tickets? Like how does that get done on a free pilot?
The buses actually have automatic passenger counting machines with the beam, so they're actually counting people by getting into the bus, and that's how we get fairly, I wouldn't say, dead accurate, but very good data on the boardings. And so a majority of these buses are actually fixed with that technology. Not all of them have it, but we know that the routes that the 28 at least had on every bus, that technology was available.
Got it. And am I right in understanding, I know there was a question about whether we overpaid, et cetera, for the 28, the initial pilot. Am I right in understanding that the way that we structured this with that pilot and the way we would structure this going forward is such that we're actually only paying for actual ridership? We're not paying for prospective estimated ridership. Is that right?
Correct. So we are paying for actual passenger counts based on a formula that we've developed with the MBTA for the Route 28. So it's It's not estimations, it's actuals.
Right. Okay, great. So then in that sense, we don't have to worry. I mean, if our numbers are, if your numbers are off in that it's wildly more successful than anticipated, even above the extra that you've built in, then you'd have to come back for further appropriation. If sadly it wasn't, and ridership was anemic, that would be its own problem, but it wouldn't mean that we were then paying, some huge sum to the MBTA for low ridership. Okay. That's helpful to understand. And then the T keeps very accurate, retrospective data, right, about the buses and the amount of time it took them. Because I know another thing that's of interest to people is whether this could actually result in more reliable service because of the ability to do all door boarding. So are we going to be able to track that from a data perspective as well?
Yes, and we have actually started to do that for the ongoing Route 28 pilot. The T, there's one thing to do well, it's collect data. And so we have very accurate travel time in data relative to the 28. We are hesitant to make direct causal relationships between the program and the significant improvement that we are seeing in travel times already on the 28. But to be sure, it's contributing in a significant way, particularly because there is less time spent at bus stops. If you're on the Route 28, you'll notice that particularly on the long stretchy buses that people have figured out that all doors are open. You can come in and out on any door. And so there's far more efficient boardings going on right now.
Mm-hmm. And I assume that is it accurate? I mean, part of the idea, right, of adding these two is that they both connect to the 28. Is that right? Or did they?
Yeah, they all they don't directly connect, but they are all part of the backbone of bus routes in those three neighborhoods, Mattapan, Dorchester, and Roxbury. There are connections at Blue Hill Avenue that all of them go through. And so Route 23 actually goes up Washington Street. So it takes Talbot from Peabody, Washington Street. It's on Blue Hill Avenue for a little bit and then connects up on Warren Street. 29 actually takes Seaver Street, but also connects with Blue Hill Avenue.
Okay, so all three have the Blue Hill Ave connection in common. Mm-hmm. No, I was wondering about sort of, because the other thing is I do know that the T, right, they try to take with their schedule into account if someone's making a bus connection, how that's going to work. And so
yeah,
if we're speeding up a whole area of the network, then in time you might need to adjust the schedule in order to make that convenient for riders.
Yeah, absolutely. And again, that goes back to working hand in hand with the MBTA's research team and their operations team, and seeing any changes in ridership trends and making adjustments accordingly. And again, the 2-year pilot gives us an opportunity to think ahead because we have 2 years.
Yep, got it. Okay, and then and sort of, and in terms of publicity, are we expecting to do like more or less what we did for the free 28 just for these three, or do we think that we would ratchet that up? Or
we, at the very least, we would do what we did for the 28, which is get the word out in local media. We had posters, big posters on all the bus stops. We had flyers in multiple languages. We really made a huge effort to market the 28. If there are other ways that we can use to get the word out, we will definitely embrace those as we move along. We're being very careful to make this a multilingual campaign.
Good. And then I guess one more question for me, sorry, Mr. Chairman, is just, I mean, I think it already came up on the council floor, right? As soon as people hear there are free buses, the next question, and Councillor Asabi George alluded to it, is, well, what about this bus, right? Like, what about this other, and we all have buses that run through our districts, or in the case of the at-large councilors, the whole city, that we know a lot of folks rely on, including folks who are low income, people of color, folks who don't have good transit access outside of the bus network. So I guess it feels like part of what we're doing here is saying yes to these two lines because between the three of them, they create this web in a underserved part of the city for the subway transit lines. But obviously, like, you're not presenting to the council today a sort of like matrix of here are all the bus lines, here's their ridership, here's what we know about the demographics of who experiences that, here's how far they are from subway lines. So you're not giving us that kind of prioritized matrix, and and for me, like, there's this good logic to kind of extending out from what we're already trying with this next step with the pilot. But I think, as Councillor Asabi George was alluding to, as you think about the thing growing, I think those comparative questions are just inevitably going to be asked. So I wonder if you guys if you have that matrix internally, if you're planning on developing it, sort of how, because I think we are all as councilors going to continue to get that question of, well, if free buses can change lives, what about over here?
It's something that we would develop over the coming months. It's not something that we've looked into in great detail system-wide. But as you mentioned, Councillor Bach, our current focus is on the low-income riders in neighborhoods that are not that well served by public, subway-like service. And so that's been our focus, particularly with the kind of economic impact the pandemic has had. And for sure, as we get a better idea, with not looking at numbers from 3 routes, we will have a chance to see how other routes lend themselves to similar pilots or a similar continuing program.
Yeah, and I just think that we have to be mindful that, I think it's great. This is causing enthusiasm for even in other cities and towns about, is there a chance to go in on something with the 1, with the 66, with the, and that's thrilling. I think the reality, and this is why I'm on the committee, it's my Ways and Means hat on, is that, like, we do make trade-offs, right, with the appropriations. And I think that starting to have some fairly consistent, I think often you launch a pilot in a place that just obviously makes sense and where there's the political will and excitement. And I think that's what happened with the 28. And I think this is a good growth of that. And it's a real pilot with a long enough period to actually make a difference for people and make some judgments and really do the data collecting. That all makes good sense to me. But I do think that if we want to strategically use city funds, and also, frankly, even if we're going to the state, we're going to the feds, et cetera, for more funding, like, we do need some of those metrics and measurements. We can't just pick lines as the thing builds that just are sort of feel like to people the next one. So I would urge the department to kind of, as you're working with the T, work on also developing those metrics, because things like distance from rapid transit is something that can be measured, right?
Yeah,
so
exactly. And we'll be sure to do that and keep you in the loop and brief.
Thank you. Thanks so much. Thank you, Mr. Mayor, for your indulgence.
Thank you. Thanks, Councilor Bach. We're also been joined by City Council Frank Baker and City Council Andrea Campbell. Councilor Mejia, you have the floor for a couple questions.
Yeah, thank you. Just continuing off of Councilor Bach's question, can you tell us specifically how we're spreading the word, particularly in languages other than English, that this service is now available? I'd like to know where the flyers have been posted. I also would like to know what languages were provided. And has anyone from the administration participated in any of the community meetings in the neighborhoods, and how many people attended those meetings? I'm also curious to know in what ways are we soliciting feedback from bus riders on these routes? And then my last question is, if we do plan to continue making these routes free, how are we thinking about the long-term affordability of the neighborhood with this service that may be very attractive to developers looking to build luxury units close to a free transit system? I'm just, that question is really looking at, the long-term here and the impact that we have when we see free transit. Just in general, it just, rents go up. So I'm just curious, like, how are we grappling with that?
Sure. Just to thank you, Councilor Mejia. What we have done is the Route 28 pilot. We haven't yet started pilots for the 23 and 29. Those would be starting later on in 2022, in early 2022. So I can talk at some length on what we did for marketing for the 28 back in August and September, when we, as I mentioned earlier, we did flyers I can't remember exactly, but I can let you know, in several languages throughout the neighborhoods. We had ads on those panels that you see in the bus over the seats. We did a social media campaign. We spread the word out to community groups that are along the Route 28 corridor. To your other point, Councillor, we have also been doing in-person surveys for the 28. So we did a bunch of surveys before the pilot was launched, where we got a sense of the perception that people had about their bus ride. And we are now currently doing, or will be doing very quickly, surveys of during the pilot to see if perceptions about the quality of bus service has changed. And so there's a team that does these surveys. People can, again, they're in multiple languages. And so we think we have good access. That's what we did for the 28. We are hoping that once this order is passed and we get organized, that we would be doing the same level of outreach for the expanded program when it does start. That's a quick summary. And Casey, did you want to add?
The only thing I wanted to add is I just looked up the languages, Councillor Mejia, that you asked for. And then for the 28 pilot, we worked in Spanish, Haitian Creole, Chinese, Vietnamese, Cape Verdean Creole, and Somali. And that was based on kind of an analysis of the most commonly spoken languages along the 28 route.
Thank you for that. And then could we just answer the last question, please, in regards to just kind of the long-term affordability and how that might impact folks being able to live here in the city of Boston, kind of like how you guys are grappling with that?
Yeah, so I can talk a little bit about that. For low-income families, transportation costs are a higher percentage of their overall household budget compared to families that are better off. And so we think that in the longer run, families who take advantage of free fares on these routes will have more expendable household incomes for other essential needs that they may have. That's our kind of general approach. I will say that we are working hand in hand with the BPDA, and they will be doing an economic analysis of the impacts and benefits of free fares on these three routes. And so that will be part of the journey that we will have relative to the analysis and impacts of this program. We think it's very important to do because it will help us think through, did we do it right? What else should we have done? How can we expand the program? What other partnerships do we need?
Yeah, and can you just give me some more clarity around how many community meetings were had, how many people participated in these meetings, as you all mentioned, in terms of, could you just give me some, like, community engagement is really important, right? So these are their dollars, right? Well, obviously, you know, we're speaking on behalf of the folks that we represent. And so, you know, I've got a lot of calls about this particular situation when it came onto the council floor about process. So can you provide us some input in terms of how you ended up here and the level of engagement had with the community?
So as I just mentioned, we did have a outreach process for the Route 28. Of course, it was during COVID, so we were not holding in-person meetings. We were participating in meetings being held by community groups where they were to get the word out. We were doing extensive flyering and advertising to get the word out. and get some feedback. I think the surveys were a good, what we really want to do is get in touch with the people who actually ride the bus. Those are the most important people to get community feedback from. And so the in-person surveys that we did, keeping social distancing in mind, where people filled in forms or were given a tablet where they could kind of go to the side and answer questions in the survey. So we got feedback on that. We are actually in the process of consolidating the feedback that we got into a comprehensive report.
Thank you for that. And I'm just curious, in your survey, were there any questions around late night T service? Like, I'm thinking about third shift workers, people who need to ride the T later. Was there any conversation around that?
Not particularly. We were just focused on the experience of riding the Route 28 in general. But we are happy to think that through in the coming month when we plan for the current pilot when it does launch in early 22.
Right, because I'm just thinking of if this is really all about COVID recovery and just thinking about frontline workers and folks who are working, right? This is what this is for, that a lot of the folks who live along this route are late night workers. And so if that is really the intention, then I think that we need to be a little bit more mindful about who's going to benefit from this service. And so I'm just putting it out there as something for you all to consider. If we're really, about that life, let's be about that life, and let's figure out how we can support some of our low wage workers who are working overnight shifts. Just want to note that.
Thank you.
Thank you, Councilor Mejia. Chair recognizes City Councilor Matt O'Malley.
Thank you, Mr. Chair, and good morning, colleagues. It's great to see so many people. I will be brief. Casey, Vineet, thank you for your great work on this. I am a full and enthusiastic supporter. I look forward to voting in favor, hopefully this Wednesday. It's obviously up to the chair. Like many district colleagues particularly, I can think of a number of added routes that would be welcome additions, but we have to start somewhere. And it makes sense, I think, to start with these lines that have been identified. And much like, Vineet, I've been here long enough to remember when we started with blue bikes, we had to, everyone clamored for them, and we had to start and then expand. So I do look forward to the expansion, and we'll obviously support this and hope it will continue. Excuse me. My only question is somewhat rhetorical, somewhat not. As we look to, the mayor's been very upfront about growing this program, particularly on fare free busing, free the T. It was very much a campaign promise a campaign pledge that she had made, and I think it makes sense as she has articulated to start with buses. As we look to grow this network out, will the cost go down as we scale up with more and more routes and potentially more and more passengers? And sort of along the thought of looking at how we did community choice energy, where we scaled up more and more people participating in the program, the cost went down. So I just wonder, Casey or Vineet, if there's any sort of thought on that. You don't have to. If you don't know, it could be too early.
No, I think I think that's remains an unknown at this point, and needs to be in partnership with the MBTA and our federal partners as well. So I think that's why we're starting with this pilot, to really jumpstart that further conversation about longer term costs. The other thing I would say is, as the chair well knows, we still have a large community process ahead of us around the remainder of the ARPA funding. And so, how this pilot informs conversation around the remainder of the ARPA funds, I think will also impact some of the longer term costs that you're talking about, Councillor O'Malley. However, right, as what we spoke about earlier, the ARPA funds are only available through the end of 2024. So a deeper conversation beyond ARPA funds will be incredibly important.
No question. We need to have this a sustainable funding stream that will be beyond the ARPA funds. I think we all agree with that. I guess my question is more, And I would think, simple economics would dictate that it would bear itself to be true that as we look to scale up this with more and more routes, serving more and more Bostonians, the negotiated price that we pay with the state should be diminished with the more routes that go on board. I would think that that would likely be what the outcome would be. And I guess we don't need the definitive answer now because we're not going to get it. But certainly, as this continues to expand, I hope that's something that we all push for. So that's all I have, Mr. Chair. Thank you all for your great work.
Thank you, Councilor Mallett, for your brevity. Chair recognizes City Councilor Ed Flynn.
Thank you, Councilor Flaherty. Thank you, Vineet, and thank you, Casey, for your presentation and for your leadership. My 2 points are 2 questions. One, I represent the largest number of residents living in public housing of any district in the city: Mary Ellen McCormick, West Broadway, Old Colony, Cathedral. Villa Victoria is not necessarily public housing, but West Dedham Street. What are we doing to assist people that are not on those routes that are already mentioned, but residents that are living in public housing that need also to get to work and they're having a tough time doing that?
Councillor, that's an excellent question. And we will have to, in the coming months, explore programs with targeted subsidies. We did that, to just give you an example, we did that with some Main Street districts where employees, of small businesses got some MBTA and Blue Bike subsidies to help them during the pandemic. So, but those were targeted particularly for Main Street district employees. And so there are other programs that exist for high school students, subsidies for the elderly, and obviously, to your point, Councillor Flynn, we should look to try and see if there are other targeted populations within the city that should be offered similar subsidies.
Yeah, thank you, Vineet. I often think that residents of public housing are not included in many of these discussions. And again, I represent them on the Boston City Council. And so I need to advocate for them effectively to make sure their voices are heard. And most of them, predominantly, it's communities of color. So I need to advocate effectively for my constituents, communities of color that live in public housing in my district. That's number one. And second is, although it's not the bus, it's the train, but the E line, which is the green line, basically going from Government Center to Jamaica Plain, the VA hospital. A lot of veterans live in the downtown area, especially at Court Street, New England Center and Home for Veterans. Many of them have difficulty coming up with the money to go to their appointments on the E line, taking the train. Can we consider having some type of proposal where veterans going from downtown Boston, going to their medical health appointments at the Jamaica Plain, they might be going for mental health counseling, they might be going for homeless services assistance, but are we able to help them? I don't need an answer now, but can we at least factor them in as part of this discussion?
Happy to do that, Councillor Flynn. We understand the need of people who serve the country, particularly our veterans, and we will look at that.
Thank you, Vineet. I have no further questions. The only thing I would add is the homeless veterans, the percent is going up across the country. They need services. We have 23 veterans a day that commit suicide. So I want to make sure any veteran that needs to get to their medical appointment is able to get there. And I have a lot of them living in my district, so I need to advocate for them. Thank you, Vineet. Thank you, Casey, for your leadership. Thank you, Councilor Flaherty.
Thank you, Councilor Flynn. Chair recognizes Councilor Frank Baker.
Thank you, Mr. Chair. I'll be brief. everybody's calling this free. It's not free. This is a bill that's going to chase us forever. So my question is, in 2 years, when the ARPA money's gone and we're talking about expanding this program, there will be a line item in the City of Boston budget that pays for, and again, pays for, that's us. That's my tax dollars. It's people that are paying taxes. There will be a line item in this in 2 years. Does anybody else other than me have a problem with this? We're looking at $8 million now. So in 2 years, we're talking about, for 2 lines, we're going to be talking about $6 million each, because it will go up probably $2 million each. That's a line item in the City of Boston budget. Can anyone answer that question? Exactly. So we're just going right into this. This is all great. 12 million in 3 years, probably. Casey, are you from the budget office?
Yeah, I'm here representing A&F today. I think that's, there are budget constraints that we need to take into consideration in the future, and that's something we're well aware of. I think we all want a sustainable funding source, and that's why it's going to take additional partners beyond the city to find a sustainable funding source. So I think that's, that is part of the reason we're doing a 2-year pilot, is to have those conversations, so we can get to a place in 2 years where it's a team effort to get this done. So that, that's where we are at this point. I don't think we have a clear answer or commitment either way at this point in time.
So if we don't have a team, it's a budget, it's a line in the City of Boston budget, which will probably be more than 6 million, be close to 10 million. I need that answered. What's it look like in 2? All great. Everybody's patting each other on the back. That's well and good. Red line's not on it. We got 3 bus lines. So what about everybody else? I just don't, you know what I'm saying? I'm happy for it. I'm glad we're providing a service, but in 2 years, it does not end. Where is the money coming from? What part of money is going to get cut out? Is it going to get cut out of the Parks Department, cut out of the Police Department, cut out of Public Works, cut out of traffic? Where's it going to be cut out of? Because there's only so much pie here.
Yep, Councillor, I kind of understand your concern, and I think it would be a part of a budget conversation in 2 years with the public process around it. I also would say we are keeping a close eye on both the infrastructure bill and the Build Back Better bill to understand if there's potential federal sources of funding for this work as well too. So, we don't have a clear answer for you at this point in time, but obviously that conversation will be through the public process if we get to that point.
So we're going to hope the feds save us. The feds will just come in, keep dumping money in here. We're going to hope for that, right? And then we have no clue as to how else it's going to get paid. And it's probably going to expand also. I just don't see how, and this is municipal finances of the old. We would put but not care about bills in the present. Let's kick the can down the road for the next administration, for the next people that are here. I don't think it's, I think we should have an intelligent response to what this looks like in year 3. 1, 2, we got paid for. What does 3, 4, 5, 6 in the future look like? Is this something that's on our books for the rest of our lives? Is anyone going to ever be able to answer that for me, or we're going to have to wait the 2 years? Thank you. That's what I thought.
Thank you, Councilor
Some of
Baker.
my colleagues should really have an issue with this here. Somebody else should. Thank you.
Thank you, Councilor Baker. Chair recognizes City Councilor Andrea Campbell.
Thank you, Councilor Flaherty, and thank you to Councilor Baker, at least asking a question about the resources. Obviously, I'm not going to be on the council next year, but I do think, I consider myself a very reasonable person. And I was really surprised that the council was going to consider suspending and passing this without at least one hearing. I can't stress how important it is, not only to ask a question about the resources, these are COVID dollars, once in a lifetime resources that the city will get. I think the public, I think counselors, I think everyone should have an opportunity to weigh in on that, to ask questions, and most importantly, not only ask questions about the money and sustainability of an initiative, but weigh in if they are going to be participating or excluded in some way. They should have a place and space for their voices to be heard. So I would encourage my council colleagues going forward, especially the COVID committee Ways and Means, to not just, I think, suspend and pass $8 million COVID request. Even if we all agree the idea is a good one, I can't stress that enough, particularly when it comes to COVID dollars. So I appreciate you, Councilor Flaherty, and Central staff for scheduling this hearing really quickly. Thank you, BTD, for being here. I apologize. I had something else on the books. I was a little late, and so I'm not in a place to do Zoom video, but I did want to at least, of course, join this conversation. So a few questions. One is, how much did the city initially pay for the 28 pilot? And at one point, I raised this when this was introduced. Mayor Wu said that the previous administration overpaid for that. Was there an overpayment? I think I heard a little bit of Kinsey Box suggesting or having a question about this, but if there was not, how was that overpayment reconciled? For this current pilot, is the T paying anything or contributing any resources? How many riders are expected to benefit from this new pilot initiative with the 3 lines? The 2 other questions, one has to do with the ride, and this may be more of a comment. It connects to Councilor Mejia's point on late ridership in the evening, as well as Councilor Flynn's point around veterans, all of which I've heard about, but I've also heard from a lot of constituents about the ride and wanting to do something with the ride. We know this is not just seniors who need this transportation desperately. It's also veterans, it's persons with disabilities, it's folks with medical appointments. So really would love for the city to think about the ride and how we work with the T to improve that particular service. So curious if that came up at all. And then my last question is there an ongoing list of routes in the queue as to what would come next? So if more resources, for example, came available, what would the 4th line be? Do we know that already? Is there a list of lines in the queue? Thank you.
I can start answering, and I'm sure Casey will jump into. Thank you, Councillor Campbell, for all those questions. One, right off the bat, the program does include the ride. And so if there are any boardings or any trips within 3/4 of a mile of the 28 corridor route, those ride trips are also part of the free program. So that was part and parcel of the pilot from the very beginning. We had done estimations with the MBTA as to what it might cost based on very kind of aggressive assumptions on ridership. And when the actuals came in, we were not up to the kind of conservative estimates that we had made. So we believe we were well under budget, which in fact allowed us to do the 4th month. So in that sense, we think that we have stayed reasonably in budget and have provided fair compensation to the T. They have had to, on the T side, they have had to do significant adjustments to their operation schedule, to do train drivers about keeping their doors open and allowing passengers on free. They've had messages on the front panel of the bus. They've done other outreach to their customers. So the T has had indirect costs to the program as well. I don't know, Casey, if you wanted to add anything to that. And I might have missed some questions. I apologize. We can pick them up.
No problem. I can come back to those that you miss if no problem.
Thanks, Vineet. I think one of the questions, Councillor Campbell, that you mentioned was around the number of riders. And one of the, as we kind of went and estimated the costs for these 3 routes, we did have to make some assumptions. And the 2 assumptions that we made were that we were going to use the fare-free pilot for Route 28 to get a rough estimate of what the fixed route and the ride paratransit weekly costs were. And, based on pre-pandemic levels, the Route 23 is pretty similar in ridership to Route 28, and Route 29 is has a much lower ridership. It's about 18% of what Route 28 is. So we use those ridership numbers to help us build out the budget. But as I've said, as we plan out over 2 years, there are more unknowns about what ridership could look like. Do we start to even exceed pre-pandemic levels as more residents see this as a benefit? And so we wanted to also leave some room for growth on all 3 routes, knowing that this pilot is going to be much longer than the Route 28 pilot. So I think that might answer your ridership question. And then Vineet, the only other thing we might have missed was ongoing list of routes in the queue.
Is there a number, Casey? So are there actual numbers of the number of riders that you're referencing? And
Yes,
so we have,
so based on calendar year 2019, so pre-pandemic, the weekday ridership for, we basically have, I'm just pulling it up right now in front of me. We have kind of the ridership by route. And I just want to make sure I'm citing the right numbers before I say anything. My computer's being a bit slow, but I can get back to you, Counselor, if it doesn't load in time.
Oh, I'll stick around. And then
Okay.
The other question is, how much did we actually pay for the initial 28 pilot?
So we budgeted $500,000, and that was paid through the FY22 operating budget. And as Vineet said, we pay based on the actual ridership. And so when we got to the end of the 3-month pilot, there was still some money that was budgeted that had not been spent. And so the administration made the decision to extend the pilot, not beyond the budgeted amount, but to meet the budgeted amount of $500,000.
So initially we said 500K for a 3-month pilot on the 28 and extended it to when? For an additional month.
Additional month, yes, exactly.
So then I'm just, and the reason I brought up the overpayment, I didn't just sort of come up with this. Mayor Wu mentioned it at a conversation. So that's why I asked, and not to suggest that the city is overpaying for this particular initiative, but I was wondering what was driving that comment when she said that we had overpaid for the 28.
Yeah, I can't speak to that exact comment, but as I mentioned, we're paying, reimbursing the MBTA based on the actual ridership, and so we'll not be going beyond for the initial Route 28 pilot, the $500,000 that was budgeted, but there was an opportunity for extension, and given the impacts we've seen, I think the administration was excited to do that.
And then I know you were still waiting on the numbers. One other question. So this is $2 million over 2 years, right? For 3 lines. Okay.
So I just
8 million.
8 million.
Isn't it 8 million?
I'm sorry, 8 million. Yes, sorry, Frank. Yes. So this is 8 million over 2 years for 3 lines.
Yes.
How did we come up with that number again? I know you're trying to pull up the numbers for the ridership.
Yep.
So how do we get to the 8?
Yep. So like I mentioned earlier, right, we made those 2 assumptions based on the cost of the Route 28 pilot, and that we would be able to meet pre-pandemic ridership and potentially exceed it with some growth. So for calendar year 2019, weekday ridership on the 28 across the whole year was, I believe, 2.9 million. The 23 was closer to 2.8 million rides. And then the 29 was around 500,000. And so we then built some estimated costs around ridership growth for this appropriation. And then as well, as Vineet discussed earlier, we also included costs around marketing, translation services, evaluation, to ensure that residents are aware of the program and that we're looking at evaluation, not just evaluating the program, not just from a ridership perspective, but also from an economic impact perspective on main streets, on residents' wallets, and a variety of different areas. Vineet, I don't know if you have anything you want to add there.
No, Casey, I think you've got that exactly right. So we've used 2019 ridership numbers, which are pre-COVID, assumed that ridership would reach those levels in 2022, and using the 28, whose costs we understand now, given that the pilot has gone on for 2.5 months, we use that information to apply to ridership for 2022. And as Casey mentioned, we have some contingency built in, because if ridership goes beyond what it was in 2019 because of the pilot, the free fares pilot, we want to be able to make sure that we had enough funding for that. We also have money set aside to do some technical evaluation of the program to get a deep understanding, not only of the data, but of the larger story.
I see that Councilor Mejia has had her hand raised and been patiently waiting. I just want to see if she has a question as it pertains to the stuff we're talking about now. Councilor Mejia?
Oh, do I come back around, Councilor Flaherty?
Yes, yeah. Well, just hang tight, because I heard her hand came up during your line of inquiry, so I didn't know whether this is kind of, we can catch this at the same time. Stand by. Councilor Mejia, you have a question?
Yes, thank you, Councilor Flaherty. This goes to the point that Councilor Campbell and Baker and Flynn made earlier in regards to, you know, the overall financial impact of this on the city. And I'm just curious, in terms of just Plan A and Plan B, was there any thought given to maybe instead of just free buses, perhaps maybe subsidizing and providing subsidies to folks in BHA housing, like to be more strategic and targeted in terms of the who is able to take advantage of free transit instead of just regulating it to these bus routes? Like, was there any thought given to, if the whole idea, right, this is COVID relief, this is really about reaching our most vulnerable, are we doing that in this case? And I'm just curious about the thought process that went into it. I mean, it's real. The fact of the matter is that, as Councilor Flynn mentioned, you know, we have a lot of housing development and folks who are living in extreme poverty. And I'm just curious in terms of just kind of what the thought process was, if just picking these bus lines just made more sense, or are we thinking about long-term, if this is really about providing supports to our most vulnerable low-income residents, why not look at that $8 million and be a little bit more targeted to spreading that pie, as Councilor Baker talked about, so that we're reaching more people instead of just a cohort of lines?
Councilor Mejia, absolutely. And as I mentioned earlier, the current selection of routes is based on areas of the city that have been hardest hit by the pandemic, that are low income, or neighborhoods of people of color. And so these have been the neighborhoods that have had the most impact. And so that was some of the reasoning behind negative impacts of the pandemic. And that was some of the reasoning behind the selection of those routes. There are targeted subsidy programs that currently exists that we can look into expanding, as has been mentioned by other councillors in this hearing. So currently, the high school students and older populations in the city get subsidies. People with disabilities get subsidies. So we want to be able to look into expanding how we can target other disadvantaged populations in the city to benefit from less impact on their household budget for transportation.
Right. So I guess my question is that sometimes we have people who are coming in from Milton and other parts, other parts of the Commonwealth that are riding our buses as well. And so I'm just curious about, if it's targeting the people who live here, or just, there might be some folks who are taking advantage of this who don't really need it. So just from a cost-effective standpoint, how are we dealing with that?
This is a program that we are continuing to analyze. We have good data from the Route 28 pilot, and it's currently focused on routes that are wholly within the city of Boston. The 3 routes are all start and kind of connect to points within the city. So we know in that sense, they are serving only our residents. And
I'm sorry, Vinny. I know that there are people who drive their cars from Milton and park in Mattapan and then jump on our free transit. So I do know that happens. And so, again, I don't want to keep harping on this, but I do think that as we continue to explore and evaluate and see what works and what doesn't, I think that's just something that we're going to need to keep on our radar, because this is supposed to be for Boston residents. There needs to be some guardrails put in place that this program is serving Boston residents, right? Not folks who are just jumping on our T here. And I do think that as we continue to move along these conversations around free transit, that we're going to have to really think about the who, the how, and how much, because this is something that, when I think about everything that's happening in the city of Boston, there's violence, there's trauma, there's our education system, there's a lot of issues that are impacting low-income communities. And so I just think it's really important for us to be super mindful of how we're spending these dollars.
Thank you, Councilor Mejia. Chair recognizes Councilor Campbell.
Thank you. I wasn't sure if the question was answered, Vineet or Casey, on what's in the queue, if anything.
We do not have anything exactly on the queue. We are looking at all the routes, their ridership within the city, routes that connect to Cambridge, to Somerville, to Chelsea. And so that would require extensive understanding, and we are currently in the process of doing that. So we do not currently have the kind of a prioritized list of routes.
Okay, and as you guys do further community engagement on this, just really want to again lift up the ride, as I'm sure you already get a lot of concerns from a whole host of residents on the challenges with the ride. And maybe the T would be willing to cough up some more resources specifically for that in some type of match program with the city on that. My last question is, taking a step back, is this initiative, now that we have three bus lines, $8 million, are we paying essentially a lower rate for this pilot than we did for the initial 28 pilot?
We haven't started the discussions with the T yet on exactly how much we would settle on per ride cost, but and this was mentioned earlier as well, there are some economies of scale here. As more and more routes are included in the program, the cost should come down. And so that's a conversation that will start with the T once we have acknowledgement that the order has been passed and we have the funds in the budget.
Okay, and then my last question is, obviously we're not in the room having conversations with the T, is what has their overall response been I know they've been pushing the city for years, obviously, in more rapid transit, bus infrastructure, lanes, all of that. But I'm just curious what their response has been to the pilots.
I would say that, and this goes back to the experience that the team had with the T for the Route 28. I think that they've been interested partners. I wouldn't say that they've pulled out all the stops to join the conversation and make the program a success. I'll be honest about that. But they've been interested partners, and they've done all the necessary things that were required of them. I had to do weekly meetings with them to set the stage for the 28, and we are looking forward. The team here within City Hall is looking forward to starting that conversation again.
Thank you. And then my last, I guess it's more of a comment, is obviously I agree with Councilor Baker on what does year 3, year 4, 5 look like. In the immediate, there are a lot of residents who are going to benefit from this, but it's not like, for example, building permanent housing where a resident will be housed in that for 20, 30, 40 years using COVID dollars. So how does this become sustainable? And you think about these once in a lifetime resources being invested in something that is sustainable long term. Look at our school buildings. Clearly the infrastructure is crumbling, immediate work needed there. So there are a lot of residents who are going to be looking at that. And so I do think it's important to have a response or answer to that question of how do you sustain this long term? Otherwise, it will just be a drop in the bucket, and would we have fully maximized the resources that this city got? And hence why I think it's really important that the council continue to have actual hearings. Thank you so much. And thank you, BTD, for the work you do.
Thank you, Councilor Campbell. Vinny, that's a great point that former Councilor Ross and I, we had the pilot program for the night owl service years ago. And it's important to manage people's expectations. We had the pilot program, and then the MBTA terminated it, leaving a lot of third shift workers and folks that we had coming into the downtown, particularly from the college and universities, sort of left in a lurch when the pilot program ended. So for your point by my colleagues here, what does sort of year 3 look like after folks have gotten into a flow there and or have taken an employment or they have a healthcare opportunity or an educational opportunity. The next thing you know, it's almost like the rug gets kind of pulled out from underneath them because we didn't forecast what year 3, 4, 5, et cetera looks like. So if you could at least bring that back to your team, let them know that was a major concern from the council. And Christine O'Donnell, I know you want to, is there anyone looking to offer public testimony at this point?
Hello, Mr. Chair. No, I haven't received any request for the link.
Very good. So that will close the sort of public testimony portion. If any of my colleagues have any final comments that they would like to have addressed before we adjourn, you may do so now or forever hold your peace.
Well, that sounds pretty dramatic there, Flaherty.
Seeing and hearing no desire for additional public testimony and or comments from my colleagues, we can adjourn today's public hearing with respect to this docket. It's docket 1, as we see here. Let me get my bearings here for a second. 1205, message and order authorizing the City of Boston to accept and expend the amount of $8 million in the form of a grant awarded by the United States Department of Treasury to be administered by the City of Boston's Chief Financial Officer, Collector Treasurer. Vinny and Casey, let me thank you both for your time and attention to this morning's hearing. I look forward to working with you as we obviously roll out this pilot for the 3 bus lines. And of course, as mentioned by my colleagues, particularly my district colleagues, are all going to be clamoring for this type of benefit for their respective constituents. So hopefully this is a success. Hopefully we can find out what the plan is beyond the 2-year pilot program and see whether or not it makes some sense. We know we contribute a little over $85 million to the T from our local assessment. Maybe some of the discussion should come around sort of that commitment and that investment that we give to the T as to whether or not we have the ability to expand beyond the 2 years for these 3 routes, but also to expand routes across the city. So with that, the Committee on the COVID Relief Funds is adjourned. And good to see you both, and thank you for participating.